Okay, great. Hi, everyone. Welcome to episode one of our brand new podcast. I'm really glad that you are here. If you're curious about the future of healthcare, diagnostics, and how technology can support doctors without replacing the human touch, you are in the right place. Um, for those who are tuning in for the very first time, I'm Sonny Mohanty, part of the SHEALTH.AI team working on the ecosystem growth and partnerships. That basically means I spend a lot of time talking to clinicians, hospital leaders, and tech partners, learning what really matters in the front lines of healthcare and how innovation can make a real impact. So, this podcast is about honest conversations, not buzzwords, and real insights into the challenges and opportunities in healthcare today. So, we'll be diving into topics like AI in radiology, diagnostic bottlenecks, data security, the role of doctors in our tech enabled world, and so much more. And today, I'm really excited to be joined by Vinod, who has been a driving force behind Shealth AI with close to 3 decades of experience across healthcare and technology. He's been deeply involved in building solutions that address practical clinical challenges, especially in radiology and diagnostics, and working hand in hand with doctors to bring those tools to life. So, Vinod, thanks for being here with us today. Let's jump right in. So, tell me something
Thanks.
about you and then Shell.
I would firstly like to thank you, Sonny. I mean, that was a great introduction, and I'm very overwhelmed with the way you introduced me, and I'm really excited for going ahead with this podcast as well as I'm enjoying this journey with Health AI, which is one of the most interesting journeys of my career so far. So yeah, so as far as Shealth AI is concerned, we are basically a healthcare AI company. We are mainly focused on medical imaging and diagnostic intelligence with a very strong emphasis on radiology automation and access to quality diagnostics. So basically, we would like to serve the nation. We would like to serve the patients by giving them a better solution and and helping the doctors and the radiologists to come up with a comprehensive treatment plan.
Impressive. So, thank you so much, Vinod. Before we dive deep into the subject itself, let's just discuss about some current challenges, right, in healthcare, specifically in radiology, that the country and the globe, especially globally, what are the challenges today we have in that space?
Thanks for that question. I think it's a very interesting question, and the most of the healthcare leaders are aware of the situation. The doctors are aware of the situation. The clinicians who practice regularly are aware of this challenge. However, I would like to bring in the actual statistics behind the whole radiology fraternity. So, to be honest, I've been traveling across certain countries. I've been a citizen of India, so I've been in healthcare in India for quite some time. So to be honest to you, if I can give you the statistics, it's like there's a huge gap. There's a huge gap which we actually see between the radiologists, number of radiologists, and the population of the country. So if I take certain examples, like say for example, has got around 10 to 12 radiologists for a population of around 10,000 people. Yeah, if I talk about China, these are most. Why I'm taking these names are because these are one of the most advanced countries of the globe. So China, if I talk about this, there are around 3 radiologists for around 35,000 people. Now, if I talk about India,
Yeah.
it's even more alarming because the actual number of radiologists for 100,000 people is around 1 to 1.5. So you can see the gap. It's a huge gap, which actually is very alarming because the lesser number of radiologists and the more time it takes to actually diagnose, and the more time it takes to diagnose, the patients get delayed treatment. So it's a cycle. It's a vicious cycle, which I think is needs to be urgently attended to, and that's why we at Health AI are trying to get into that solution where we can bridge that gap.
These are very really key statistics that you've shared with us, Vinod, for those who are tuning in for the very first time, that's quite alarming, those numbers, you know. So,
Absolutely.
so that's the problem statement. How is Shealth playing a role in resolving this problem?
So yeah, so that's the key thing. So basically, as Shealth AI, as I told you, we are basically a AI based company. So it's not only AI solutions that we are providing for the radiologists and for the patients. We are coming up with. We are also providing teleradiology solution, the telereporting solutions. So basically, it is a comprehensive method where you combine or integrate AI with telereporting, and then eventually come up with a report. Now, you ask me, how is that related to the statistic that I shared? To be honest, if the number of if we have to report a certain patient, the turnaround time is very, very important. And then when it comes to AI and telereporting with the radiologist, it actually reduces the turnaround time, which eventually benefits the patient in terms of coming up in getting the report and getting the treatment further.
Right. That's quite interesting as well. I mean, you know basically mentioned about AI like several times. I mean, artificial intelligence obviously is, I think, is a tech enabler, but there is always a kind of fear, I would say, because you see in the news today, people claim that AI is going to take up our jobs and everything, and there's a lot of speculation around that as well. So here in this aspect, are you saying that, you know, with the help of artificial intelligence, we are actually going to get rid of human capital? Or here, AI is actually going to help these people who are actually in charge of telereporting and making the lives easier for the doctors to be doing a critical operation, for instance, in this case?
Okay. To answer your question in a simple way, I read a note somewhere a couple of days back. It says, it said that AI can scan reports, AI can detect diseases and
Yeah.
suggest treatment faster than any human being, but it cannot hold the patient's hand, sense their fear, or even console them. So this, I think, answers your question that AI will definitely not replace the doctors, because the human touch is very, very important. AI is just going to ease the solution by fastening the process of diagnosis. But eventually, the radiologists are a very, very, very crucial and a major role in ensuring that the diagnosis is being, which the AI has come up, is actually being validated by the radiologist, so that it is released to the patients with error-free, a kind of error-free reporting. So, to answer your question in simple words, AI doesn't replace doctors.
Yeah, you know what? I would absolutely, agree to the points that you mentioned. The other day, I was watching some sort of, on a television. I was watching some channel, and I saw like people in China. Now, in China, they have some sort of machines where a patient can walk into that machine, and obviously, it's going to read all your vital stats and give you a prelim report sort of thing, where you could see if there are any issues or ailments in your body, and you can go and you get prescription and medicines dispensed from that machine. So the idea over here is, what happens that frees all those the specialists and the senior doctors and the surgeons to do critical stuff and the research that goes around it, right? Because if you see in a hospital setup, especially in India, like country, I've seen, because in Singapore it's slightly different, but I've seen in India, like it's massive, and obviously one doctor probably is seeing like hundreds of patients on a daily basis, and not everybody is coming there for a critical illness, right? Some of them do turn up with a heavy head or some soreness, right? So yeah, I agree. AI obviously is there to improve efficiency by reducing the time for doctors or the clinicians or the surgeons to do other critical stuff.
True.
That's quite interesting. Yeah. So because Shealth AI is obviously a startup backed by XDC Ventures. So XDC Ventures is a venture VC arm of XDC Network, which is the layer one EVM compatible blockchain infrastructure that we have. Um, with that in mind, I just want to know, because today everything is a borderless, right? With the advent of blockchain, everything is decentralized. So, having said that, how Shealth AI is placed today? Is it like catering to particular markets, or is it geography agnostic and global? How do you address the solutions that you have for Shealth AI?
So, to answer to your question, yeah, we as Shealth AI are concentrating on. It's obviously decentralized. It's nothing concentrated to one particular one particular country. We are looking to work around the globe to provide our solutions, specifically the AI-based solutions and the telereporting solutions combined. So eventually, what we are planning to do is we are trying to do POCs with with different hospitals and across the countries, and also ensuring that we do the pilots for the AI, as well as integrate the telereporting solutions for the certain hospitals where specifically there is a specific radiologist shortage. Because in one of the visits in the hospital that I had, I had a chance to interact with the leadership team, and it was shocking for me to know that the patients do the CT and MRI today, and they get the reports after 3 days. Yeah, so you can imagine the amount of pain that the patient actually undergoes. I mean, if you're coming up with to a hospital, you're obviously not coming for a leisure, right? So you're coming up with a pain, with a complaint, and then eventually when the doctor examines you and tells you that uh, you need to do your MRI to diagnose further and to take the treatment further. And when the patient agrees to it, he pays for it. And then eventually, after undergoing the MRI, he waits for the reports for 3 days. I mean, if that is the case, if somebody is in pain and has to wait for 3 days to just get a report or diagnostic report, you can imagine the treatment plan is so delayed. Eventually everything is delayed. So as a patient, I would love to get my pain diagnosed within a couple of hours, and my treatment getting started in the next few hours, so that I get relieved of my pain. And if I come, or if I have to give even a bad example, say I am if there's a patient who's come with a road traffic accident. Yeah, he comes into the casualty with, say, probably a head injury.
Mm.
And eventually, the head injury has to be evaluated with a CT or an MRI, depending on the seriousness or the severeness of it. So, if the doctor advises a CT MRI and the patient is in a dying state, and after the CT MRI, there is no one to report. So, how is it going to help? I mean, the patient can lose his life. So that's where Shealth AI is going to be very, very crucial. We have got a pool of radiologists who cater to the needs of reporting, and we have got a quicker turnaround time, which is less than 2 hours, and for an emergency cases even 30 minutes. So that's where we are going to pull in, bridge that gap to ensure that everything is reported on time, the patient's life is saved. And at the end of the day, as healthcare leaders or healthcare specialists or clinicians, everyone's objective is to ensure that the patient life is saved, and that's what we are all here for. And we have all been blessed by the God to serve this, to so that we serve the population of the country, and by saving lives.
Wow, that's like gave me goosebumps actually. Okay, it's good that it's about turnaround times and why Shealth is very key and important in this aspect, right? A personal question: you've been a global citizen. You've lived and worked in Africa, right? And now, if you may allow me to say this, you are sitting in El Salvador. cracking something. I don't know if you're on NDA, something cracking something with the government there. So, what differences do you see in these geographies? And you are obviously Indian citizen. Countries like Africa, US, India. What kind of differences are there in terms of these kind of services, which are really critical, time sensitive? Like you meet with an accident and you need urgent service, otherwise your life is at risk. What happens in Africa? How does this teleradiologist operate over there? Is there any teleradiology service, or how does it work? Like they have in-house, can they afford in-house radiologists? Because apparently these radiologists are doctors who are not, economical to hire, right? So
Agreed. Yeah. So to be honest to you, when I was working in Africa, I got a very good opportunity to work in Africa, and my experience there was awesome. Uh, as far as answering your question about the radiologists availability in the country, it's very rare. It's very rare.
mm,
Uh, you actually don't find a radiologist in the country. In fact, specialist or super specialty is very very rare, and that's where in countries like Africa, you might have heard that medical tourism is on high. People of the country come to other countries to get treated. Okay, so obviously, if I have to get a scan done, obviously I can't come to India from Africa, right?
yeah,
So obviously they get done there, but again, the reporting has to be done, which again, there's a shortage, severe shortage of radiologists. And most of the hospitals in Africa, even the government of Africa
mm,
is promoting teleradiology maximum. They love to get the diagnosis done ASAP, and that's why they are promoting teleradiology. And most of the hospital, as I told you, is into teleradiology the Indian teleradiology companies are actually reporting for the country. Now, as far as India is concerned, India at least is fortunate that we have got a lot of specialized doctors, qualified doctors, and
mm,
the availability and the treatment is much better. I'm not contradicting to what I said in terms of the first question that you asked. The ratio against the population. India's population is much higher, and that's why the radiologists count. The ratio is very different. However, if I talk about Africa, the population is much, it's very, very less.
right.
Okay. If I have to actually cater to that population, and if I had the same number of radiologists that I had in India, it would be a heaven in Africa. So that's
Mm,
that's not the case. So, and in India, that's why I said, we have got qualified radiologists. However, looking at the population size that we have, it becomes really, really difficult to cater to the needs on an emergency basis. So that's where India is placed. Now, if you ask me about thanks for mentioning that I'm in El Salvador. Yes, I am in El Salvador currently, and we are talking from there. I'm again fortunate enough to have discussions with the Ministry of Salvador, and we are doing POCs with couple of hospitals here, followed by the pilots for AI. And also, we are in talks with providing teleradiology solutions for the private hospitals and the public hospitals. Here again, the situation is the same, because
mm.
as I told you, when I spoke to a couple of them, they were saying it takes around 2-3 days for the reports to come out. So yes, we are trying to address to these concerns, and we're going to provide the solutions at the earliest.
Great, amazing. Talking about government hospitals, hospitals in general, where the doctors or the management is dealing with sensitive data like customer data, the patient data itself, which is subject to data protection and security. How challenging it has been for Shealth and Shealth AI. You can also mention your target audience. Like, how do you, for example, you are approaching a diagnostic center where they do provide imaging solutions as opposed to a hospital and a government hospital for that instance, right? You have, like, different ways of approaching. I think each of this customer segment is different. The way they would operate with a technology based client would be obviously different, right? So how is Shealth breaking that barrier when talking to each of this customer segment?
Yes, of course. As you rightly mentioned, the data protection, the patient confidentiality, these are very, very important aspects as far as catering to different countries or hospitals are concerned. Because even if I talk about catering to a hospital in India, they would be very, very keen, and they would ensure that the patient confidentiality of their patients is not leaked out, which is obvious and which is a fair ask. I'll appreciate that. So it's similar in other countries as well. So as SHEALTH.AI, we are very clean in the approach. We are very, very clean and clear in by telling that every hospital, most of the hospital have got the PAC system with them. So if they have their PAC system with them, all the images of the patients and the reports are stored in their PACs. Okay, and if we also offer them a private cloud setup solution, which is going to be very, very helpful, so that the data that is of the hospital, of the patients of the hospital, do not leak out and is secured in their own network. So it is actually saying that everything remains in your house, it doesn't come out of the house.
That's great. On-premise cloud, I guess.
Absolutely.
I suppose that's what it called. That's great
Absolutely.
because it's very important for if I'm a patient and I would obviously I do not want my details to be leaked out, and that's very key. As you said, Shell has this private data, facilities that this hospitals can leverage off. Besides being, having a very fast turnaround time with the artificial intelligence that we have. Coming to artificial intelligence and AI, so how is these AI are being trained for various modalities and diseases? Because we have X-rays, we have CT scans, we have MRIs, and if I see MRI report, like obviously we all have done probably once in our lifetime, they're like different, so many different aspects of that little scan that you see. So how do you actually train the AI? It's not easy. It's quite complex for me to just prima facie see how it all works.
Correct. So again, training the AI is something which is not a 1 day task or a 2 day task or a month task. It The AI gets trained and improved day on day. It's never 100% accurate. Okay.
Mm.
So today, if I claim, or any of the telereporting companies or any of the AI companies claim that they're 100% accurate in coming up with a report, I would blankly object to it, because any machine learning model, any artificial intelligence model has to be trained continuously, because there is always a scope of growth. There is always a scope of improving further, uh, to ensure that whatever is being delivered to the patient is very close to being accurate, but not 100% accurate.
Mm.
Now, to answer to your question as to how do you train your AI model, so we have, as Shealth AI, we've got our own CNN classification model, yeah, and we have the LLM integration. So we do this, combining these, we have. We tested the AI. We have trained the AI with used cases for CTA and MRI. So the DICOM. So every CTA and MRI comes up with a
Mm.
DICOM file. So
Right.
the DICOM file is basically fed into the AI model. And eventually, what happens is the way it comes out with a report is very interesting. I'm sure you would have seen
Mm.
the CT and MRI scans, right? So they have these small, small blocks,
Yes.
in the films that the hospital gives you. These small, small blocks are called as sequences. Okay, now when the DICOM file is fed into, so if you see a CT or an MRI of a patient, the file, the DICOM file is sometimes very, very huge. It has got you know. Uh, 3,000 to 4,000 images that are scanned by the technician of the hospital, and eventually, when 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 the radiologist actually reports, how does he report? Is actually he goes through the series of the sequences, and then builds up on certain sequences and comes up with a report. So he does it manually. What AI does is the same thing. It runs through the sequences and generates a report. It analyzes the whole sequence and comes up with a report. Now, again, the report that comes up is majority, most of it is covered, and the impressions, the findings, the diagnosis is very clearly mentioned. And again, as I told you at the start, that the human touch is important. So the radiologist gets a review of the preliminary report in just 3 minutes, and then eventually he can just amend it, or probably add or delete something if he thinks has to be added, and then release the final report. So if you ask me, the whole workflow process time is very, very less. So as compared to what a radiologist has to actually do, is go through the sequence, then type in the report, and then release it. And when you have a huge load of patients waiting for an MRI and CT reports, it becomes very, very difficult for the radiologist to cater to the turnaround time. That's where AI plays a very important role. It reads through the sequence, analyzes it, and comes up with a beautiful report to be validated by the radiologist.
Amazing, amazing. I think that's a fantastic use case for of AI in the healthcare space, specifically radiology. That's what I think of. That's great. Thanks for sharing that, Vinod. I'm sure you've shared this just now about El Salvador, that you're doing a pilot. If you are not on any NDA, if you are happy or okay to share this information with our audience, what are the other pilots, POCs, or commercialization that you've done so far, in the space?
Yeah, so we have done POCs and pilots in one of the hospitals in UAE. Now we are doing it in Salvador with the ministry. And eventually we are aiming at doing the pilots for AI in other private hospitals in Salvador, as well as certain hospitals in India as well. It will be quite early to share the names. So because we are just in a
Right.
discussion phase, and getting into an agreement, and sharing certain credentials which the hospitals require to ensure that they are happy to take on our pilot. So that's why I'm not sharing the names. However, yes, the pipeline is huge, and we are hoping that this pipeline keeps increasing, and we cater to all the needs. Eventually, that's what the whole objective is for Shealth AI. We eventually want to ensure and bridge this gap so drastically that every human being who has the right to get treated on time is being treated on time. So that's where the punchline is.
Like that. Fantastic. Thank you so much, Vinod. This has been a very, very great conversation. Thank you for sharing your insights and for walking us through not just what Shealth AI is building, but why it matters. I think one thing that really stands out is that AI in healthcare isn't about replacing doctors. It's about supporting them, reducing pressure, and making sure patients get timely and accurate care. So,
True.
to everyone listening, thank you for spending your time with us today. This is just the beginning, and we're going to have more episodes in upcoming episodes. We will continue exploring the real challenges in healthcare, real solutions, and real stories from people building and using this technologies on the ground. So all of you who are watching, who have tuned in, if you found this conversation useful, do follow the podcast, share it with your colleagues, and feel free to reach out to us with topics you'd like us to cover. Thanks again, Vinod. Thanks
Thank you
everyone
so
for
much.
tuning in. We'll
Thanks for
see you in
having
the
me.
next episode.
Thank you so much.
Great. Thanks.
Thanks. Bye.
Bye bye.